Greetings, esteemed colleagues and guests. Today, I have the privilege of delving into the intricacies of gastroesophageal reflux disease, commonly known as GERD, a condition that presents multifaceted challenges in both diagnosis and management. With this presentation, Understanding GERD Insights and Innovations, I aim to focus on these while explaining GERD. GERD affects 10 to 20% of people in the Western world. It's the most common gastrointestinal disorder with significant healthcare spending. GERD is characterized by recurrent reflux of stomach contents, leading to various symptoms. GERD is a chronic ailment characterized by the reflux of stomach acids into the esophagus, and it stands as a significant contributor to global health concerns. The objective of this presentation aims to elucidate the pathophysiology, epidemiology, and evolving management strategies of GERD, bridging the gap between advanced scientific understanding and public awareness. GERD is a chronic condition where stomach contents flow back into the esophagus, causing symptoms and/or complications, which we will cover in later slides. GERD affects approximately 18 to 28% of the population in North America alone. In contrast, its prevalence in East Asia is reported to be lower, ranging from 2.5% to 7.8%. The healthcare costs related to GERD are significant. In the United States, direct costs attributable to GERD were estimated to be approximately $10 billion annually, not including over-the-counter medications. While most GERD cases are not severe, about 10 to 15% of GERD patients are at risk of developing Barrett's esophagus, which is a condition that can increase the risk of developing esophageal cancer. These statistics highlight the widespread impact of GERD on both health and healthcare systems. The causes of GERD encompasses a spectrum from lifestyle choices such as dietary habits and obesity to intrinsic physiological factors like the compromised functionality of the lower esophageal sphincter. Understanding these causative factors is pivotal in crafting effective management strategies. The lower esophageal sphincter, or the LES, is a ring of muscle at the bottom of the esophagus where it joins the stomach. It acts as a valve, opening to allow food to pass into the stomach, then closing to prevent stomach contents from refluxing back into the esophagus. In GERD, the LES doesn't function properly. It may not close completely after food passes from the stomach, or it may open too frequently, allowing stomach acid and contents to flow back into the esophagus. This reflux can cause the characteristic symptoms of GERD, such as heartburn, regurgitation, and here I have a photo of the stomach, and you can see the food and stomach acid with the arrow going towards the LES, or the lower esophageal sphincter. Symptoms and diagnosis. So the hallmark of symptoms of GERD include heartburn and regurgitation, affecting patients' quality of life. Less common but significant symptoms include a chronic cough, asthma, difficulty swallowing, and belching. Understanding these symptoms is crucial for diagnosis and management. These symptoms are not only painful, but lasting when these symptoms aren't treated, as stomach acid is always present in the stomach. Diagnosing GERD, aside from observing obvious symptoms, include an endoscopy. This procedure involves inserting a flexible tube with a camera through the mouth and into the esophagus and stomach. It allows direct visualization of the esophageal lining to identify signs of damage from acid reflux, such as inflammation or erosions. It can also detect complications like Barrett's esophagus or strictures. Biopsies may be taken during endoscopy for further analysis. Also, pH monitoring. This test measures the acidity in the esophagus over 24 to 48 hours. A thin tube is passed through the nose into the esophagus, or a small capsule is attached to the esophageal lining. The patient records symptoms while the device logs acid levels, allowing correlation between symptoms and acid reflux events. This is especially useful when symptoms persist despite treatment or when the diagnosis of GERD is uncertain. GERD significantly impacts daily activities and overall well-being, including psychological aspects. Individuals with GERD often experience discomfort and pain from persistent symptoms like heartburn and regurgitation, which can disrupt daily activities like eating and sleeping. The chronic nature of the condition can lead to anxiety and stress, fearing the onset of symptoms, particularly in social or work settings. Sleep disturbance due to nighttime symptoms can result in fatigue, reduced concentration, and mood changes, further affecting mental health. Overall, GERD's physical symptoms combined with its psychological impact can markedly diminish quality of life and daily functioning. Treatment, lifestyle modifications specifically for avoiding GERD typically involve dietary and behavioral changes. Key recommendations include maintaining a healthy weight, as obesity increases abdominal pressure, promoting reflux. Diet-wise, it's advised to avoid foods that trigger symptoms such as fatty acids, chocolate, caffeine, alcohol, and acidic foods like citrus and tomatoes. Eating smaller, more frequent meals rather than large meals, and avoiding eating close to bedtime can help. Elevating the head of the bed can reduce nighttime symptoms. Quitting smoking and reducing alcohol intake are also beneficial, as both can weaken the lower esophageal sphincter. Regular exercise, while avoiding high-impact activities post-meal, can also aid in managing GERD. Treatments as far as medications go for GERD primarily aim to reduce the stomach acid and relieve the symptoms. The most commonly prescribed are proton pump inhibitors like omeprazole and esomeprazole, which effectively reduce acid production and promote healing of the esophageal lining. Histamine 2 or H2 blockers such as ranitidine also decrease acid production, but are generally less potent than PPIs. Antacids providing immediate but short-term relief neutralize stomach acid. In some cases, prokinetic agents are used to enhance the LES tone and improve gastric emptying. It's crucial to balance medication effectiveness with potential side effects and long-term risks. Advanced treatments for GERD are surgical options like the Nissen fundoplication. This is a surgical procedure where the top part of the stomach is wrapped around the lower end of the esophagus and stitched in place. This reinforcement of the LES reduces acid reflux. It's usually considered when long-term medication is not effective or for severe GERD symptoms. And an emergent treatment modality is the LINX. It's a magnetic device placed around the esophagus to strengthen the LES. Endoscopic treatments like transoral incisionless fundoplication are also emerging, offering less invasive options than traditional surgeries. And again, these advanced treatments are typically considered in severe GERD cases when standard medications aren't really working. Okay, prevention strategies. We briefly spoke about most of these in the lifestyle modification slide, but it is key to prevention, a lot of those, like we talked about diet and lifestyle recommendations, all those that we spoke about. So maintaining a healthy weight, eating smaller and more frequent meals, avoiding those spicy foods or caffeinated foods, alcohol, things like that, and not eating close to bedtime. Elevating the head of the bed can help reduce those nighttime symptoms, and quitting smoking, and again, limiting alcohol intake. Importance of regular medical checkups. So regular visits to a healthcare provider can help monitor and manage GERD symptoms effectively, and then early intervention can prevent complications and adjust treatments as needed, ensuring optimal management of the condition. Highlights of current research. So ongoing research is delving into the molecular and genetic factors contributing to GERD, aiming to understand the variations in disease presentation and response to treatment. Studies are also exploring the link between GERD and microbiome changes in the gut. New medications. So researchers are working on creating new drugs that more precisely target stomach acid production and improve the movement of the esophagus. Minimally invasive surgeries, that's always ongoing. And then scientists are also looking into treatments that are personalized for each patient's specific condition to make them more effective. Something about GERD is that, like that tailored treatment suggests, every single person is different and every situation is going to be different. There's not an overall treatment that helps every single person. There's not a specific food that triggers GERD for every single person, but more of a general statement for everyone. Global and local perspectives. So impacting different regions, like we talked about in Western countries, a higher prevalence is noted, partly due to the dietary patterns and the obesity rates. In contrast, Asian countries report lower prevalence, which might be linked to different dietary habits and lower obesity rates. Comparing treatments and strategies worldwide. So treatments approaches also vary, with Western world medicine heavily relying on pharmacological treatments like PPIs and H2 blockers. And in contrast, some regions emphasize dietary and lifestyle modifications strongly. Public awareness and healthier access also play a crucial role in how GERD is managed in different parts of the world, affecting diagnosis rates and treatment effectiveness. So in summary, GERD is a prevalent condition characterized by acid reflux, causing symptoms like heartburn and regurgitation. Its causes include LES dysfunction and factors like obesity and diet. Treatment ranges from lifestyle modifications and medications to advanced surgical options, while ongoing research is exploring new treatments and personalized approaches. The importance of awareness and management. Again, it's crucial to increase awareness about GERD, its impact on quality of life, and the importance of early and effective management. Understanding and addressing this condition can prevent complications and improve patient outcomes. Final thoughts. GERD is a complex condition with significant impacts on health and lifestyle. Effective management through a combination of lifestyle changes, medication, and possibly surgery can greatly improve patient outcomes. Continued education and awareness about GERD are essential for both healthcare providers and patients. Keeping abreast of the latest research and treatment options can lead to better management strategies and overall health outcomes. Thank you.